4th day of the phase 2 recovery at the state. So, a lot of good things going on. We did start seeing our mammography patients this week. And hopefully next week we'll be expanding out, doing a little bit more OR cases, bringing back some of the eye cases, et cetera. So we are tracking where we're going, and appreciate all the hard work as everybody has pivoted back from the interim roles we had to create during the COVID expansion here, normal roles, and we really appreciate all the efforts everybody is putting in to help us get our volumes back to normal. As always, please, if you have any questions, enter them in the chat window. You can start putting them in there now, and we will answer all of those at the end of the presentation. So, all right, John, you ready?
Yes. Thanks, Steve. So, thanks everyone for joining us this afternoon. And we already see a couple questions in there. I'm going to just I'll get to it in a little bit, but there is a question in there about self-reporting and how long we'll have to do it for, but I'll get to that, but don't let me forget. All right, let me just make this a little bit smaller, so there you go. Once again, just as a reminder, if you hit the bottom of the bubble at the bottom, you can go ahead and enter questions, and you can either send them to to everyone or Steve or myself, but it's easiest if everyone sees it. That way they know what the question is when we answer it. Thanks. All right, I'm just going to, this first few slides I have are some, good, or I have several slides today with some nice news I'd like to share. And this was pointed out to us this morning by Lane, and this was in the Worcester Telegram and Gazette, and this was just an obituary. And it said, the Horain family will be forever grateful for the compassionate care and comfort provided by all at UMass Marlborough COVID-19 unit and the ICU, with much appreciation to Elizabeth and Bridget, who were with our mom to the end. So thanks, and this is, just time after time we're getting these terrific notes of the care that you guys have provided for the patients that have come to Marlborough Hospital. So thank you, and I like being able to share these, so thanks. Some information, kind of the generic COVID information, and I'm looking forward to the day where we can stop sharing these slides. But these are slides that are positive and some good news, and they're showing that from Massachusetts that our trends are really heading in the right direction. The 7-day weighted average, is continuing to decline. You can see that it's about just around 4.2%, 4.2% right now, just under 5%. Where a month ago it was higher at 12%. So significant decline. The next day is a 3-day rolling admissions, and I think this is a very important one to us. We were at 4,000 patients, so we're continuing to decline. We're continuing to be in a much better spot, and I think this is, to me, this is probably one of the most important ones, as this is really the impact of work that we're seeing. The testing depends on who you're testing and what population. But the people that are coming to the hospital are sick, so we're continuing to see a decline in that, which is fantastic. Number of hospitals using surge space has continued to decline. It's right around 4 now, and then 3-day average of COVID deaths, and this continues to decline as well. And once again, these are posted every day on the Department of Public Health website. There's about 30 slides that come out every day, and this is, I think I'm now down to just one slide that I'm showing you from, but you're welcome to go look at it. This is a slide that Steve Roach sends out every day, just as a quick update of where we are from the community hospital standpoint. And I used to share a different one with you, but I'm just trying to make it a little bit easier to understand, to give you a quick snapshot. So Marlborough Hospital today, had 3 PUIs this morning. Inpatient positives were 11, 2 patients on ventilators. So if you remember from a month ago, this is a huge difference. Staff is still working very hard. These patients still require a lot of work, but we were pushing 30 patients that were positive at one point, and we were stuck in the mid-20s for a very long time, with the ICU at 10 or 12 patients at times. So we're heading in the right direction, and it's definitely improving overall here. So these are 2 quick slides I'm going to go over. And I'm not going to go over a lot of information, but I want them in here, and after the presentation's over, this presentation will be automatically sent to you, so you can take some time and look at them on your own if you like. But these are the slides that are coming from the state, and they talk about the different phases and what can happen in each phase. And they're interesting to read. There's a whole there's about eight, I think there's about 8 or 9 slides that the state came out with that you can go and download from the Department of Public Health website as well if you'd like some more information. But this is how we're functioning when we talk about phase 1, phase 2, phase 3, phase 4. This is where we're getting the information from, and this is these presentations do a good job summarizing it. This is another good slide of kind of what was happening in phase 1, phase 2, and onward. And to highlight the things that we really can't be doing right now are elective cosmetic surgery and day programs. And our behavioral health day program is functioning over telehealth, which has been a great job by Heidi and Katie getting that up and running. And they started this week, and they're continuing to build their patients. So great work for everyone up there for getting that up and running, because certainly a needed service, and to be able to provide it over telehealth is leaps and bounds. Probably something Heidi never thought she'd be doing. Just a quick snapshot of how we're doing in imaging and recovery, because I think it's important for folks to understand, some of the numbers. And radiology is a very, very large portion of our outpatient business at the hospital. So all it says is all CAT scans, ultrasounds, X-rays, and mammography. And this shows you, starting in March, where we were kind of pre-COVID, and the massive decline, and then our kind of COVID time, and then how we're slowly building up. And we'll continue to show you this slide every couple of weeks to show you where we're going and where we're headed. But Paul and the rest of the radiology group is doing a great job getting patients back in to get screened and continue with exams. I was talking to Michael this morning from ultrasound, and he was saying how busy it is down there, and I think it's fantastic that we're getting these patients in, that they're comfortable, they're getting through the hospital safely. Too many people have been home, not getting their medical care that they've needed. So I'm proud of everyone being able to operationalize this and get it done. So great work. So I'm going to talk just a few minutes about kind of what we're going to be focusing on regarding COVID over the next month here at the hospital. We got wound up very quickly, and now there's lots of things that we have to continue to look at and say, okay, what can we take apart? What needs to stay? But just to give you an idea of some of the work that we're looking at right now, it's kind of the business change. The hospital entrance, the greeter, the waiting rooms, break rooms, meeting rooms, all these things have gone through some kind of disarray. And the hospital entrance is continuing to be transformed. Paul Ruggieri and Ellen Carlucci have been working on that with several folks of kind of making what the new permanent or semi-permanent hospital entrance is going to look like until we're, for the foreseeable future. And that's to have a, kind of one pathway into the medical office building, one pathway for employees to enter, then one pathway for patients and visitors. We will continue to need to screen everyone that enters the hospital. So to answer the question about the app, there's no end time on that right now. For the foreseeable future, we have to do the app. So thank you for taking the time to do it. I know it's just one more thing to do and remember, and even myself, I find myself at times coming very close to forgetting to do it. So it is a challenge, but please continue to do it. It is important. It's an important piece for us to be able to say that we're doing it to be open up as a hospital. We are in the process of hiring greeters. As we've had folks, filling these roles from the labor pool, we're using temps, agency folks, for 8 to 12 weeks to fill these roles, because there may come a point where we don't need to be doing all of the work that we're doing. But for right now, we still need to be doing it. We're going to have greeters, and the entrance of the hospital is going to be different. So please be patient and understand that they're just, there's a role that they have to do that has to be done. We continue to look at the waiting rooms. A lot of work has already been done by facilities, and with the help of Ellen and Hillary, getting the extra chairs out and making sure that we're social distancing. It's a key piece to make sure that we are social distancing in all areas of the hospital. So lots of changes, and you've probably physically seen them. You see the steps on the ground. If you have any questions or concerns in your area, please bring them forward to your manager, and so we can get them dealt with. We want to make sure that we're kind of tackling all these. Labor pool, we continue to help in the labor pool as everyone's kind of going back to their job they were hired for. We're really looking for help. So if anyone's looking for extra time, please get in touch with Stacy, as we continue to have needs still right now with greeters, still with tent testing and mask cleaning. So those are still very important things that we need to get done, and it's just becoming more of a challenge for us to do it. Tent testing, just a quick update on this is that, we continue to have the tent testing outside. We will have tent testing for at least another, month or two, from what I understand, and this is continually being reviewed, but it's not going away anytime soon. What we are doing is we are going to consolidate the tent testing so that it's run out of the gravel parking lot out front and out of Leahy. So there's been some physical changes made, but the goal of that is to make it a little bit more efficient and be able to decrease the amount of folks that are dedicated to tent testing by about 50%. So more to come, but you will see some changes starting next week around that. We continue to do pre-procedural testing on Sundays, and we're open just in the lab, so not tent testing. The tent's closed on Sundays, but the lab's open from 9 a.m. to 12 p.m. to do the folks that need testing for Tuesday. So they have to be tested less than 48 hours out. Their COVID test has to be done less than 48 hours out for pre-procedural testing. So that's folks that are going to the OR, GI, certain radiology exams, PFT testing, and several other things. But we are open specifically for that, and lots of great work by getting that orchestrated, and thank you for that. Outpatient services, we started doing mammograms and screening mammograms this week broadly. This was something that had been a kind of a delay, and it was certainly a concern of everyone. Now we've opened that up, and so the Southborough crew is doing a terrific job getting those patients in and have ramped up pretty quickly. The same holds true for GI procedures and operating room procedures. We've been increasing our volume. We resumed inpatient cases this week and have done a total of 5 inpatient cases, which is great for the patients being able to get in and the physicians and the staff. So we are seeing some of the work that we used to do return to the hospital, and I'm encouraged that folks are comfortable in returning to the hospital. There's still lots of people that are scared, and we're working on that. I'll actually jump right to the bottom. We are in the process of getting a video created that's going to be about Marlborough Hospital and what to expect when you come here. That will be on YouTube, will be on the local news channel, so people can anticipate what's going to happen when they arrive at the hospital and to help them feel comfortable. So inpatient changes, that's we're continuing to review that and what we're going to do with the negative air pressure fans. Do we need to continue or not? How big of a COVID unit are we going to need to continue with? Are we going to leave that as Granger 1? What are we going to do for staffing and the likes down there? And how are we going to separate, patients in the future? So lots of questions to be answered down there. We're hashing some of these things out, or began to, as well as the ICU, as we have all the negative pressure fans, located in the entire visitor section. We have to decide if we can leave those or if those should be moved or what has to happen. And that's all tied into the Joint Commission prep and our life safety around the hospital. So lots of focus and lots of work being done as we're trying to sort this out. So if anyone has concerns about something in their area, please bring it up to your manager. Let them know, because there's so many things that got changed, and we want to make sure that we're paying attention, or that we're aware of it. And if you have a suggestion, we're certainly open to ideas. There's a social distancing task force. Just to give you an idea, these you'll see signs like this around, but I touched on this a little bit about point of entry, documentation areas, rounding structures so we don't have big groups, break areas. That's the additional waiting rooms. Behavioral changes, making sure that we're aware of where we are and how close we are to folks. Everything's changing for the patients, but you'll see some of these signs around, and we'll continue to focus on this, and this is going to be a continued work in progress. Patient experience. I did want to take you a few minutes about patient experience, and we have done a tremendous job at Marlborough Hospital with patient experience over the last couple of months, and even since October of this year, we've done very well. Better than we previously have. So thanks to everyone for all your work on this. And I have some great comments. And Press Gang actually sent us an email telling us that they had noticed that we had some really fantastic comments during, March, April, and May during our busiest COVID time. And I'll have them on the next slide to share with you. But your attention to your patients is noticed. So great work. And thanks for all your efforts and focus on this. Here's a couple of them from inpatients and emergency department. I will, I'll just read the top one of each one, and then I'll keep moving for time. It says for inpatients, I want to thank the nurses and doctors at the ICU. I want to thank the nurse R. She was so good to me. Thank you all, Marlborough Hospital. That's from the inpatient emergency department. Everyone was very calm, friendly, and polite. I was very impressed they could be that way under the circumstances of the pandemic going on. So great comments, and thank you. So infection control update. Some new updates. Eye protection, now for all close patient encounters. So that's pretty much if you're communicating or talking to a patient in person, you should be wearing eye protection. And, that's been sent out. There's eye protection that's pretty much readily available, but we do have some kind of less eye protection that is not as big and bulky for folks that are doing more administrative work or registering patients, so things along those lines that you can get from your manager. There's been some resolution around the COVID infection banner and who cannot remove the flags. A big question that comes up is always around COVID testing, and this is just as a quick reminder of COVID suspect versus COVID surveillance. The COVID surveillance patient is, a suspect, is a PUI, and all patients in the ED are screened for COVID-related symptoms, and if they meet the criteria, they are immediately flagged as COVID suspects. Caregivers are required for full PPE and follow strict isolations until ruled out. So these are the PUI patients, and anyone that we don't think has COVID becomes a surveillance patient, and that's something that we've been doing now for over a month, and they don't require the high level of PPE. So admitted patients who present with other medical conditions not related to COVID are ordered a COVID surveillance test to identify if they're asymptomatic. These patients have very minimal risk of transmission, and caregivers only require contact standard across surgical mask and eye protection. And then as a quick reminder to folks that if you're transporting a COVID patient or PUI, you need to have a clean person with you to open doorknobs, push buttons, etc. Quick update on testing or information. So, we've been doing the oral nasal swab, and that's a PCR test. We've now gone to saliva, which is also a PCR test. It's actually the same test. It's just a different way it's collected. If there's questions about that, the lab can certainly answer them for you, but it's just as accurate as the nasal swabs were. It's just a much easier getting it. Just to remind folks to mute yourself if you're not talking, because we have a little bit of background noise. Thank you. As I had mentioned, we'd gone to surveillance testing a little over a month ago, and then on the 19th, we started doing pre-procedural screening. Some other, there's other testing available, antibody testing. There's still lots of questions about it and how accurate it is and what the point of doing it is. It is available as outpatient at Carewell if you wanted to go get your test done for yourself to see if you've had it. It is fairly expensive, I think $150 plus. And it's available, at the medical center, and will be available here shortly for, very certain, individuals will need ID approval to be done. Employee health, this is the self-reporting. We've been averaging 89–90%. So thank you. Continue to work on that. I know there's some glitches, and if there are glitches in your area, so if you're constantly being reminded to do it, and you are doing it, please make sure there's you've gone to your manager and they're working with employee health or the help desk to resolve the issue. Employee COVID testing, 83 tests have totally been done. We've had a total of 12 positive employees. 11 have been cleared and returned to work. So that's been fairly stable now for the last 2 weeks. And respiratory protection, all of our COVID cases, we still reserve the masks, and the correct mask, you're N95s. Any specific questions on that, please put them in there, and we'll let you know. We'll answer them. So you matter. This is going to be something you're going to hear a lot about over the next couple weeks, and this is just being rolled out by the system. This is a way to recognize employees. You'll be able to do it yourself for someone else. Managers will be able to do it, and there's a fair amount of information on it. But it's whether it's you want to say, "Hey, happy birthday" to someone, or in certain circumstances, there's a way to tie money to it to give someone a monetary reward, a minimum monetary reward. So keep your eye out for it. Sign up for one of the demos or watch one of the demos online so you can become familiar with it and understand how to use it. But we're fortunate to be able to have this to be able to thank everyone for the work that they're doing and being able to highlight it in a timely fashion. Big news here is that we do want to congratulate SPADMA. As several folks know, that Joan Davis is on slowly retiring, and she's going to be replaced with Padma. She's the new Director of Quality, Patient Safety, and Regulatory Affairs. So we are currently looking now to replace Padma's position as an infection control preventionist. If you know someone that wants to be the new infection control person, please let us know. Have them apply. It's a very difficult role to fill. She's been doing an excellent job, and we're fortunate to have her staying on and being able to transition this new role. So congratulations, Padma. I'm looking forward to working with you. Annual training. This slide didn't, something happened here, but that's all right. Just a reminder, annual training is coming out. Please take a moment to look it up and then take your time to do it. You have until the end of, pretty much the end of, the deadline is, end of September. So we've rolled it out. There was a little bit of a delay due to COVID, but it's out there and you can go ahead and get it done. Nursing education, quick few nursing education things. I'm going to go really quick now because I want to be able to answer questions. Nursing orientation's been modified. We're starting up on the ACLS PALS and BLS. Nora's working on that. She's looking at a way of trying to do it over WebEx so that, she can do larger groups and people can get it done and then just come and do the practical piece of it. We're paying attention, looking at the policies, making sure up to date there. Telemetry class has been modified. We continue to talk about what's going to happen to nursing students and other clinical rotations in the fall throughout the hospital. As of right now, we're not taking them, but that's still under review, and we're making plans. Obviously, people need to be able to get in the hospital to get the education they need to go on. So we're working on that, as is every other hospital. And we just did our pump upgrade yesterday. Thank you, Nora and Kevin, for your help with that. A couple of pictures of the women's imaging project. If you don't drive it by every day, it's coming along, and we're looking forward to having that open in September. I'm going to hand it over to Steve to talk about finances, and then we can start cracking away at some questions.
Sure. Thanks, John. I just want to touch base on this pretty quickly. As everybody probably should know or recognize, this is going to be a very difficult, tough financial year. The month of May alone, we're posting a $2.3 million operating loss. We were closed primarily for all of our outpatient volume. The month of May, we did restart at around the 20th, but it took a while to get everything back in place. Took a while to get patients lined up, and not everything was brought back that early. So, we're still facing some tough financial issues across the system. I think we're, as a system, down $73 million through April. Doesn't include all of May. We'll see what the final numbers are for May in the short term. We'll add that in there. But, it's been a very challenging year. And hopefully that's why, we're really focused on getting our volumes back up to normal. We need to get that volume back up so that our revenue matches up with our expense base. Otherwise, at some point we get to have some trouble. So we are working hard on that, and if there's anything that you all could do to drive that, that'd be great. We'd really appreciate it. That's going to help both the hospital and everybody there. So that's just a quick summary of the financials. We do have some questions that have come in. John, the first one, are we mixing surveillance patients in the same rooms as elective joints on the inpatient side?
I do not believe so. I believe I don't believe so.
Okay. And Mary, the second one was about mask cleaning. I think Dr. Scheimer answered that after peroxide has been discontinued, and we're only doing the UV cleaning of masks at this point. There is a question, though, for hospitalists not being able to now remove precautions. Have they been trained on that? Apparently that's the questions out there. What training have they been through?
Here's where are we? There we go. I don't know, Viva or Padma, want to talk about that for a moment, as they're far more familiar with the whole process? We'll give them 1 minute to see if they want to talk about it. And I had one or two other questions. I don't know. Not everything's going to everybody. There was a question.
Yeah, go ahead.
There was a question about the masks. And are we going to be using peroxide? No, we're staying with the UV lighting process. We're not going to be using the peroxide process. We use UV lights. We're going to continue using that process. Question about the app. We've talked about that.
Hello?
Hello? Yep.
Yeah, this is Padma. So I just want to answer the question regarding removing of precautions. So the providers always had the access for the removing of precautions. It's just that they got additional access to remove the COVID precautions. So they were removing the contact precautions, contact test precautions. It would be the same process, but now they can also remove the COVID precautions. So they are already trained, and we just have to educate them, and we are sending communication to different groups on this.
Great. Thank you, Padma.
Thank you. Yep.
Right. There's a question in here that was sent to myself, Steve, I think, with everybody. When we are expecting the Joint Commission. So, our window's open for the Joint Commission. The lab was due for their visit by the end of March. So we're anticipating that they're coming any day for the lab, or can be here any day for the lab. Our window is open until next June, I believe, for the hospital. They obviously took a 8-week break, so I don't know what if they're delayed or what their plan is, but we're in the process of we're prepared for them if they were to show up, but obviously there's lots of fine tuning and work that we'd like to get done prior to them getting here. So we're continuing kind of our focused Joint Commission preparatory work now, but I don't even want to guess when they're coming because it'll be wrong. If we get more information or we have a better idea, we'll certainly pass that along.
Yep. So for clarity, Padma, are you still on?
Yes. Yeah.
The question that Mary's actually asking is not technically how they can go in the computer and do it. Have the hospitalists and physicians been trained to screen patients for removal?
How to screen a patient for removal?
Yeah, do they know the process? Is it 2 tests negative, 1 test negative? What is that?
Yes, yeah. So they were trained. So there is a protocol, and the providers are updated on this. Presently, for the inpatients, if it's 2 tests negative within 24 hours apart, the providers can remove the precautions. And on the outpatient basis, the providers are trained based on the CDC symptom-based approach that if the patient is symptom-free for more than 3 days, after 14 days of the initial test, they can remove the precautions. Yeah, they are trained on how to screen the patient for removal, but more communication is going to be sent to the providers on this from the system.
Thanks, Padma.
Thank you.
All right, John, any other questions that you've seen?
I have a question right here. It says, unless surgical masks have been shown to be clinically superior to cloth masks, won't it save money employees brought in their own cloth masks? So surgical masks are superior. What they're able to separate and from a filtering standpoint is far superior to a cloth mask. So the surgical masks are better, and that's why we wear while we're wearing surgical masks in the hospital, not just cloth masks. Thanks. Let's see if I have anything else here.
Yeah, and staying on that one, if you're not, for us, those of us who are not in direct patient care roles, we probably don't need a new mask every day, because if you're in an office, you're not wearing it all the time, et cetera. So there's definitely some opportunities within that. But, clearly if it's soiled, ripped, or torn, or dirty, you need a new one. But if you don't need a new one every day, you're not working directly with patients, then try to conserve.
I don't see any more questions, but Yoli's back, so welcome back. So it'd be great. I understand that you'll be back maybe, I think you said you'd be back maybe next week if I remember correctly. So looking forward to having you back. I think you said the 18th or 19th you're done. So it'd be great to have you back. The hospital's been doing a super job, and they've certainly been busy moving a lot of patients out and helping us out in our busy days. So thanks, but we're looking forward to having you back as well. No, Steve, have you had any other comments?
I don't see any other questions coming through. I think the most important piece is just to thank people for all their efforts, especially those people in the short term who are stepping up to help staff the areas that we still need in place that are not their normal roles. We are going to continue to need those for a period of time until we can roll those programs back safely. So I want to thank everybody for that, and just the stress that's associated with pivoting back from the interim roles back to your normal roles and starting to ramp that volume up. It's a lot of work, it's a lot of effort, and we really appreciate everything everybody's putting into that. So.
All right. Well, thank you, everyone. I appreciate you signing on, and hope the information was helpful. It'll get sent shortly.
Have a great day.